Hello, Dr. Sondhi. How are you?
I'm very good, Dr. Mahajan. Thank you very much for inviting me to your show. And I thank you on behalf of the community of Tampa Bay for doing this service, which I am incredibly grateful to you to do that. So let's start off with the acid reflux. So, what is acid reflux? It can be known as heartburn, acid reflux, GERD, or gastroesophageal reflux disease, which is the medical name of this thing. So we have a lot of people, almost 40% of the population will experience heartburn at least once a month. And about 10% of the population will feel it at least once a week. So you can imagine millions and millions of people have this condition. So it's a condition where you're feeling like a burning sensation at the back of your throat. But that is the most common scenario. But then there are very other atypical manifestations of reflux. Some people can experience chest pain, some people can have regurgitation, some people can present with nausea or vomiting. So you never ever ignore it saying that, oh, it's just a reflux. Oh, it's just a little heartburn. If somebody has acid reflux for more than 2 days a week, it needs to be at least discussed with the provider, with the family doctor. And if it is more persistent, it could be a sign of something bad. So, my first advice is never ever ignore your reflux because it could be a sign of something bad.
Yeah, so let's talk about lifestyle changes, which can help with the acid reflux. Is to avoid the common triggers. We have a picture of chocolate, wine, red wine, coffee here. So those are very common triggers for acid reflux.
So, what do we do for chocolates? Everybody loves chocolates. It's, you become the bad boy when you tell somebody avoid chocolates or avoid coffee. There are a lot of other things which we can do. For example, we can drink decaffeinated coffee. And if you have to drink coffee, just restrict the intake of coffee to maybe 1 or 2 cups of coffee a day. And as far as chocolate is concerned, you can have some chocolate, but don't eat too much of it and every single day.
So the causes of gas and bloating. Again, not a sexy topic, but but it makes a lot of people uncomfortable when they have too much flatulence and too much bloating. And we get a lot of patients, asking us what can they do. So these are the common causes of having too much gas and bloating. Yes, great points. And again, similar lines, what you're talking about, avoiding the foods like cauliflower, cabbage, broccoli, beans, and brawn. By the way, they are the best foods. So be careful in eliminating them altogether, because these are the foods which get you beautiful nutrition in terms of fiber. All right, so let's get to the next piece up here, prebiotics and probiotics. So, what are prebiotics and what are probiotics? The prebiotics, guys, is the scaffoldings. So, in other words, the gut needs nesting space for the good bacteria, your microbiome, to thrive. So, what constitutes a prebiotics? That means before we add the friendly bacteria, we need to provide them friendly homes. And how do you get the prebiotic? Let's bring that slide up there. So if you look through this slide, these are the food that support healthy gut. And if you look at it, it's interesting because onions, garlic, bone broth, pineapple, asparagus. We'll talk about sauerkraut in a minute. But if you look at 2, 3, 4, 5, 6, there is no fermentation going on there. They just have what we call fiber, the good fiber for the gut to thrive. And then you look through the rest, and again, number 10, the dandelion greens, again, is fiber. Now let's talk about the rest. The apple cider vinegar, kimchi, ginger, again, is prebiotics, and the sauerkraut. Now those are fermented foods. Fermented foods, it could be buttermilk, could be kefir. We didn't add that to the list, but you can add yourself to your list. Kombucha is another drink. These have Mother Nature provided good bacteria, which are good for your gut. So you don't have to spend money on buying those probiotic medications, which are, we don't know what temperature they've been stored, and the microbiome is a exploding field, and we are barely scratching the surface. So I rather have a fermented drink, what we just alluded to, the kimchis of the world and the sauerkrauts of the world, then have a probiotic pill, which I don't know what's in there and how much live colonies are in there. So if you combine the prebiotics with probiotics like ginger, garlic, onions, any form of greens, any form of fibers, any form of fruit with skin, you will have a beautiful home for the friendly bacteria of what you're introducing to your fermented drink. And also the body has been given the microbiome over the lifespan from your parents, from your friends, from your colleagues who you work with. So you do have your unique microbiome, and you need to keep nourishing it, keep making it happy. And the best way to make it happy is, again, less stress, less anxiety. Again, it comes down to autonomic nervous system, a lot of hydration, mostly water, and nothing carbonated, nothing processed, nothing lunch meats, and giving, if you want to, kefir and buttermilk and other fermented drinks. If you use that combination consistently, I think your gut will sing praises for you. You want to add something more, Dr. Sondhi?
Yeah, that's what the common theme of the day is, that we have healthy lifestyle, lose weight, not smoke, don't drink, eat the good bacteria, eat the good foods, and hopefully will prevent cancers and prevent all kinds of different GI as well as other conditions. So I agree, make your healthy bacteria, friendly bacteria your best friends, and hopefully you live long.
Let's just highlight what we covered today, Dr. Sondhi, and you can add if I missed anything. For all the cancer from your esophagus all the way down to your rectum, it could be avoided. So that's the take-home message. If you start early in your life and don't pick up habits like smoking, drinking too much alcohol, all those cancers in your gut can be avoided. So that's number one take-home message. Number two take-home message, as Dr. Sondhi very beautifully said, the body is a temple. Give good offerings. That means give good food, folks. That will what keeps the cancers and the infections and the inflammations away. So high fiber diet, a lot of plant-based diet, anything which comes from plant, eat more. Anything which is made in a plant, which means manufacturing plant, give it to the boyfriend or girlfriend you don't like processed food, like bacon, like pork, red meat, processed meat, less, and then exercise regularly and sleep well. Sleeping is beautiful for immune system to recover. So if you do that consistently, not only your gut will be happy, I think your whole body will be happy. With that, we come to the end of the show. We want to thank Dr. Sondhi for coming to our show and sharing his time. And I know he's very busy. We want to wish Dr. Sondhi and his family a happy new year, and hopefully COVID-free for all our listeners. And we will see you on next webcast on next Tuesday. Thank you, Dr. Sondhi.
Thank you, Dr. Mahajan, for inviting me.
At Mahajan Medical Center, we care to listen to our patients. Proudly serving the needs of Tampa Bay in primary care for 25 years and counting.